My name is 𝘗𝘬𝘯𝘦 and I currently live in Cambridgeshire, the United Kingdom. I was diagnosed with relapsing remitting multiple sclerosis, MS, 10 years ago in 2014. I first realized I had some complications in 2012, which I was not aware of that it was MS related. I co-owned a care business with my friends and I used to do the payroll every month. And when I was preparing the checks, we used to write checks then for our staff. I realized that after every third to fifth check that I was having difficulty in seeing what I was writing, and I had to take breaks, a couple of minute breaks between every 3 to 5 checks to recuperate and to be able to write again. So the next day I went to the optician and they checked out my eyes and they said that I require a prescription, but they also noticed that I had some bleeding on my optic nerve, and they said they're going to inform my GP, which I also did, and he referred me to a specialist. By the time I got to the specialist, things cleared up. They thought that it could be glaucoma. They had other suspicions, but it went unnoticed, so things got better and it went unnoticed, as I said, my MS. Then again in 2014, I was in the garden with my friends. It was a nice sunny day in London. I used to live in London then. And we were barbecuing. And I realized that I wasn't feeling well. I started to have a kind of headache sensation and pains in my right eye. And I thought it could be hypertension because I used to be hypertensive in the past. So I thought I'd have a shower and lay down and rest and get some sleep. And that's what I did. And when I got up, the pain was excruciating in my right eye. And I couldn't see properly. My vision was very blurred. And I got very frightened, to be honest. I didn't know what was going on. So I ended up going to Moorfields Eye Hospital after talking to my GP. And there I saw a specialist who done some tests and scans, and he said that I have optic neuritis and he believes that I also have multiple sclerosis. So following MRI tests and scans and further tests, it was confirmed that I had multiple sclerosis in 2014. Following that, I looked into it, see what I could do to manage my condition. And I come across a program called the Overcoming Multiple Sclerosis program, known as the OMS program. It is a lifestyle intervention based around diet, healthy diet, the plant-based seafood diet, stress management in the form of mindfulness meditation, vitamin D supplementation, flaxseed omega-3 oil supplementation. So it's a healthy lifestyle which I incorporated on the day I found out of my diagnosis. And that helped me to manage my condition until 2021. So I was relapse free for about 7 years and I was going quite well. And then I got the sudden news that I lost my mother, who was in Cyprus during the COVID period. And I was in the UK, and it was a sudden shock to the system, very unexpected, and it had a very big impact on me, more than I anticipated. And following that, I had a relapse in August 2021. And as a result of this relapse, I started to encounter difficulty in breathing. I noticed I had difficulty in breathing, and that was due to a brainstem lesion which I had at the point of my diagnosis. And I also started to encounter bladder and bowel issues, and seriously discomforting bladder and bowel issues. And all of these started to impact on my quality of life, my daily living. I couldn't go out. I was always suffering, always in pain, always anxious. And I started to feel very isolated. My quality of life, as I said, was all over the place. And I was in a miserable place, so I had to do something about it. I started taking the recommended disease-modifying therapies. They helped to some extent, but only to some extent. So I started looking into stem cells, and I've done a lot of research. I love doing my research. I've done a lot of extensive reading. I read a lot of the clinical trials because it's experimental, so I had to be sure. I had a lot of question marks. And I discussed the issue with my family, and they supported me in the idea of pursuing treatment with stem cells, even though it was experimental, because I knew that I had to do something about it. So I started to looking into relevant clinics that provide such a service, and due to its proximity, it's in Europe, and also, more importantly, the approach that they had in their treatment protocols was kind of more reassuring comparatively to other clinics, which I also looked at. So I further pursued my mission to get stem cells treatments with Swiss Medica, which is located in Serbia. I contacted them via a representative, and they kindly arranged a consultation meeting, which I had with a doctor. It was very thorough. We had a discussion. I sent all my medical history prior to the consultation, so they had an understanding of my circumstances and my symptoms. And we discussed it, and following that they devised a treatment protocol, which they sent to me, and I had a look at it. I had some further question marks, and I wanted to have a second meeting with them, which the representative arranged, and they kindly set it up with me. So I had a second consultation with them to clarify my question marks, which they kindly did. And I was comfortable with the approach. What was important to me was it was a combination of treatments, my own stem cells, the autologous stem cells, and also donor stem cells, and the application of it as well, intrathecal via my spine, intravenous via my veins, and also intranasal via my nose. And that was a kind of combination protocol which they devised for me, in combination with some certain significant vitamins that I needed to take, and very comprehensive physiotherapy, which I must admit I was very impressed with the level of professionalism that I witnessed from the moment I walked in through the door. The physio was at a different level. The kitchen staff, because we had accommodation there, we stayed there. They provided the meals for us, and as I said, I followed the OMS diet, the Overcoming Multiple Sclerosis diet, which is a very particular diet. They were very accommodating and very helpful in accommodating my diet, so the kitchen staff was very helpful as well. The doctors, the nurses, they were fascinating, very professional, very kind. You feel the human touch when they're treating you, and it was very reassuring. So I'm very satisfied with the outcome. I waited. They told me that you should expect to see if you do any results within 3 months. Within the first month, I started to notice some improvements in my bladder. I started to have more control of my bladder. And in month 2, I realized that this also started to occur with my bowel as well. So I started to have more control of my bowel, which gave me more confidence. I also had some issues with my right side, which I forgot to say. I had another relapse in February 2022. So I had 2 relapses after the passing of my mother, and a very stressful period which I went through, other personal stressful issues. And that affected my right side. I had some right side weaknesses, particularly in my right hand. So after the physio and the first treatments, I also realized some improvements in my right hand and strength in my right grip. After the second month, this even got better. I realized that I could lift things, heavier things. And in month 3, it's almost back to normal, my right arm. So that was very satisfying for me, and that was very tangible. But most importantly for me, the most significant improvement I've realized, and this has happened in the last kind of 10 days to 1 week, is I've seen a gradual improvement in my breathing. And breathing is life, and that was a serious concern for me. I had a lack of oxygen coming into my body due to the irregular breathing I had. I always had breathing, hunger of breath difficulties. That created a lack of oxygen in my body to an extent when I was initially had the relapse that my ankles were swollen. And now I'm almost breathing near normal. And that's a substantial change and substantially reassuring for me in regard to the outcome of the stem cell treatment that I got at Swiss Medica. When I started doing my research, I looked to have the research because I wasn't sure of if I was going to pursue the treatment or not. First, I had to be comfortable myself before discussing it with anyone. And once I got my own head around it and thought that this is a viable way forward, even though it is experimental. It's been experimental for over a decade, and there has been a lot of positive outcomes from a lot of MS patients. And taking into consideration the fact that I didn't have any form of disability because I've been managing my MS quite well. My mobility is quite well. I thought that I would be an ideal candidate for the treatment, and that I'd probably attain better outcomes in regards to results. So for me, that's the core of my decision-making process. If that makes sense and I get the support of my loved ones, it doesn't matter what other medical authorities or whatever they say. I respect them. I would follow their opinions, which I always do. I've got a lovely MS team in 𝘱𝘬𝘁𝑥 Hospital, particularly my MS nurses. They're very responsive and open. But I didn't tell them about my treatment because it's about it's about me at the end of the day, and I didn't want to be influenced in any way or have any kind of negative feelings about it. I made my mind up, and I wanted to pursue it without that kind of negative commotion going on. But I did share the outcomes and the discharge reports which Swiss Medica provided, which is very detailed. And they were satisfied and they were happy with what I shared them, and they were happy to hear that I started to get some good results and outcomes from it. So I'm sure that they're going to follow up. I did try to get into some clinical trials that done regenerative stem cell treatments, but I wasn't eligible. You have to be at a very poorly stage to be eligible for those types of clinical trials, and that exceeds its purpose, because if you're that poorly, you won't probably benefit as much if you get it done before you have that kind of demyelination. So it was a kind of a no-brainer for me. I did have a lot of question marks in regard to stem cells. I was not comfortable until I done the research myself and done extensive reading. The experimental nature of it is also, an issue that I had to take into consideration and take seriously. But the trials out there, there was a lot in it, and I looked at a lot of testimonies of some patients as well. I also contacted a few patients who had stem cell treatment, and it made sense. So that's why I pursued it. The treatment was a quite comprehensive treatment plan. It lasted for around 9 days. I went in the beginning of December till the mid of December in 2023 last year. It was comprised of a combination of different procedures, procedures where they extracted my own stem cells from my own bone marrow. That was the most concerning and frightening part prior to going to the clinic. I read a lot about that, but to be honest, they took me into this very hygienic room that's allocated for that purpose. It was very professional and clean, and it was very reassuring. The doctor who came, the technician who came to do the thing, was always reassuring me. I was also accompanied by a nurse who helped me prep for that. And so even though it was kind of, I had a question marks and a bit scary, it wasn't painful. It was just minor pain because you have local anesthesia. So after the procedure, you feel a bit of numbness and a bit of pain for a couple of days, but it was nothing major. I also had some IVs, donor, placenta, and umbilical cord stem cells. And I also had exosomes from my nose, intranasal sprays. And again, a combination of those altogether with vitamins, relevant vitamins to help the stem cells, and some active physio every day. I think the physio was life-changing as well. I didn't anticipate the significance of the physio in this whole process. And yeah, it was substantial, especially the 𝘗𝘰𝘯𝘵 chair that I used. That really helped my bladder as well initially to kick things off. As an outcome, the results I started to see positively, as I said first, was I noticed some improvements in my bladder. I started to have more control of my bladder. I also started to get more strength in my right arm and my right hand, particularly my grip. And this gradually improved. My bladder gradually improved, my right arm gradually improved until today. And also then I started in month 2 realizing some improvement in my bowels. I started to release my bowels much more comfortably. It became less of a stress. And most recently, as I mentioned before, and my most concerning symptom was my breathing. I had irregular breathing, hunger for breath, shortness of breath. It became even worse during activity and exertion. But after the stem cell treatment, initially I didn't see any difference in my breathing, but the last 10 days I've started to see some gradual improvements. And the last 3 days, it's almost near normal. It's not perfect, but it's almost near normal, and there's a substantial improvement in my quality of life. I'm able to go outdoors now. I'm able to have more control of where I'm going and what I'm doing. I'm more confident in going out. I couldn't find employment after selling the business because I wasn't feeling well enough. Now I have the confidence to seek employment again. So stem cells it's giving my life back in reality when you think of it. I'm more confident to get back out there and do things again, which I haven't been able to do for the last three years. The initial improvement I felt was, whilst I was still at the clinic, I started to see some improvements in my bladder. That's the first improvement that I started to see. It was when I was traveling to Serbia, for example, it was very stressful. I had to book a hotel a night before because of toileting issues and toileting concerns. I always planned beforehand, and on my return, I didn't encounter that stress. I didn't encounter that anxiety, even though it wasn't at the level where I am today, which it's even better. It was much better than the point of when I arrived to the clinic. So I had a much more comfortable journey on the way back due to my bladder. That for me was an immediate realization of the improvement. I've got my confidence back. I've got hope back again. I believe that I can do things again. I don't feel as isolated. I think that I could find some employment again, because I was out of employment due to the circumstances I was going through and the symptoms that I was encountering, and because my quality of life was doing so poorly on a continual basis. So it has given me that hope, and it has given me that platform to function again and to pursue the life that I used to prior to the relapses. I'm going to pursue a top-up as well. I'm going to go back to the clinic at the 6-month mark for my top-up dosage, and I'm looking forward to that, and I'm looking forward to continuing my life as I did prior to the relapses I had in 2021. And I believe that the stem cells has given me the platform to do that. The advice I would give to a person with multiple sclerosis, it's a very serious condition, and I know that no one takes it lightly, but my advice would be to do whatever it takes. Do what you believe works for you, because it's your life, it's your condition, you're living with it, and it's a part of us. So do whatever it takes, and if you do believe that, even if it's experimental, that stem cells will suit you and will work for you, go for it. It's a no-brainer. And do it before you have serious nerve damage, because the earlier you do it, the better results you get, because that's what I believe in how I've achieved. I believe that because I've got less damage, that I attain better outcomes from the stem cells. And I do believe that on the second part, I'm going to get even more, I'm looking forward to it, I'm going to get even better results, and to continue with my life as normal and manage this condition as best as possible.